There, how's that?
Okay, perfect.
Good, good. So let me just jump to the first slide and you can start asking the questions. Well, I congratulate you for having the courage to bring up one of the most controversial areas about the application of glutathione in taking care of our health. As you can see from the slide here, this is an area that's drawn an incredible amount of interest, almost 30,000 articles on PubMed. And this is the reason I say this is controversial. There are very distinct and differing opinions on how to approach this. At the very least, let me say that the literature can be very confusing. So let me start off by saying it's quite clear and agreed upon that people with low glutathione levels are at significantly higher risk for the development of cancer. This has been shown by several methods, not just measuring glutathione levels, but more recently, because of our ability to look at the human genome and determine DNA coding. These studies, which look at individuals who have abnormal glutathione genes, show them to be particularly susceptible to cancer. This is very revealing. Now, what makes this situation even worse is that cancer itself will further lower glutathione levels throughout the body. So, study after study shows that total body glutathione is lower in cancer patients than in the healthy population. This makes the patient's defenses even weaker. This is further demonstrated by the strong evidence that cancer patients with higher glutathione levels have far fewer negative side effects from their chemotherapy and radiotherapy. In other words, higher glutathione levels improves the tolerability of treatment, which we're all aware is often as unpleasant as the disease itself. Well, as we mentioned before, this is one of the most challenging areas that we need to talk about. Here is the major reason for the confusion in the literature. When you measure glutathione levels in most solid human tumors, you find that these cancer cells are actually high in glutathione. Very interesting. This can lead us to coming up with contradictory conclusions. Let me explain and pay attention. You need to wrap your head around this. For example, because these cancer cells are high in glutathione, the cancer cells themselves use this extra glutathione to protect themselves from the chemo or radiotherapy. In fact, this has been used to explain the resistance to treatment that certain cases have. This has led to a lot of research where cancer cells are grown outside of the body in what we call cell cultures, and experiments are done on the cancer cells themselves. Now, what has raised a lot of attention is that if you can deplete glutathione levels in cancer cells, you can make them more susceptible to damage by chemotherapy. Well, this is a critical question. This has been addressed in many clinical trials. And this is why we must make any major decisions on treatment based on human trials. I say this again and again. Laboratory studies and animal studies are so important to our understanding, but when you take these experiments to a human study, so often we're surprised of the outcome in the real world. This is important. When you lower glutathione levels in human patients before chemotherapy or radiotherapy, the side effects of the treatment are so severe that the approach becomes impractical and unfortunately even results in death of some of the patients. And scientists are still trying to find a way to do this, so far with little success. Well, I have to think that most well-read people would not argue too much with raising glutathione in patients who are not undergoing chemo or radiotherapy. And again, please ask your own oncologist his or her opinion on this before you use any supplements. Always listen to your doctor before you listen to something you found online. Well, here's what I've been proposing to doctors and scientists for a long time now. Um, I have to tell you, this has been a long and difficult argument. You need to start by looking at all the available literature and trying hard not to cherry pick the articles that only support your point of view. So I welcome all of you to do this yourself, especially the doctors. Always do your own homework. You'll find that the vast majority of the successful studies looking at lower glutathione before chemotherapy have been in tissue culture or test tube studies, not in humans. I say vast majority because I have not actually found any that have been useful enough to consider using as a clinical intervention. If any of you find one, please send it to me. And just as importantly, I've not found a single article where raising glutathione levels in human cancer patients has backfired. None. So if you come across one, again, I need to know, so send it to me. And to make my life easier, because I was spending so much time answering this question again and again, I wrote this article. It's essentially, it summarizes what we just spoke about, but in much more detail and with dozens of references. Please feel free to read this if you want a deeper understanding. Well, here's where it gets a bit technical. We'll need to look at some of the biochemistry about how glutathione is manufactured in the cell. I'm not going to go through this whole pathway, but it's important to note that there are many steps for a cell to take to make its own glutathione. If we narrow in tightly to one spot on this diagram, we see that the amount of glutathione that can be made by the cell has a certain limit. Because you see, when you reach a certain ceiling of glutathione concentration, it will act to down-regulate production or slow down further production. So in this manner, a cell will make a pre-programmed amount of glutathione and no more. Now, because cancer cells already have super high levels of glutathione, it takes only a little bit of precursors to shut down production through negative feedback inhibition. The first step was to show this in cell cultures, which immunotech scientists have done in much earlier studies. Again, I won't bore you with the details. Here are some references to look up if you want to get deeper into this. Essentially, you see where levels drop at the end of these curves when glutathione precursors get too high in the tumor cells. Of course, I tend to be more of a visual person, so let's look at a visual model. So here we see a bunch of glutathione precursors. Note that I've labeled some of them CY for cysteine, the limiting amino acid, more specifically bonded or bioavailable cysteine. When these glutathione precursors are taken up by normal healthy cells, they are used effectively to raise glutathione levels. But when they get to the cancer cell, which already has super high levels of glutathione, they cause the negative feedback inhibition mechanism to kick in, as we saw before. In simpler terms, the healthy cells start to produce glutathione, but the cancer cell is induced to make less glutathione. So effectively, what happens, as you see, is a selective modulation of glutathione levels so that glutathione levels climb in healthy cells but drop in cancer cells. Ultimately, the result is that the healthy cells become more resistant to the damaging effects of the chemotherapy, but the cancer cells have less resistance so they could be damaged or die off quicker. Selective modulation. I hope that's a bit clearer now. Well, you're asking what most people want to know. Show me some proof. So take a look at this. Let's just read this title. Cysteine-rich protein. In this case, we're talking about Immunical, reverses, please take note of this word, reverses weight loss in patients receiving chemotherapy or radiotherapy. This was the first study that ever showed a nutritional intervention, I'm not talking about drugs like anabolic steroids, that actually reversed the muscle loss seen in end-stage cancer patients. Good nutrition can slow down the process, but we actually reversed it right there in the slide. This clinical study met all of the criteria for what we call a gold standard study, randomized, double-blind, placebo-controlled, and it took place in multiple excellent cancer stations across Canada. Initially, we wanted to look at both lung cancer and colon cancer, but we didn't recruit enough bowel cancer patients, so we focused on lung cancer. It's important to note that in our inclusion criteria, these patients had to have shown signs of muscle loss. In other words, they were in late stage cancer by definition. Some of the easy, very objective measurements taken were body weight, cell mass, and hand strength. Of course, we wanted to look at quality of life measurements, which really count more from the patient's perspective. These are a bit more subjective measurements, so we used a number of different measurement profiles. You see them here. And here you go. A clear and significant increase in body weight and muscle mass. First time ever. And here you see that the patients themselves reported significant improvements in their quality of living. This alone is critical. Finally, the burning question, did these patients live longer? Let me just point out this group of numbers. A year after the study was completed, we went back to see who could report on their condition. About 80% of the patients treated with Immunical were alive. Less than half of the patients who did not receive the Immunical that passed away. These are very encouraging numbers, and I am calling out for more studies to validate this. So let's summarize. Yes, we all know that cancer cells are often found to be high in glutathione. In fact, this high level in cancer cells may cause them to be resistant to treatment. When you grow these cancer cells outside of the body, then lower their glutathione levels, this makes them more susceptible to being damaged or killed by chemotherapy and radiotherapy. However, when you do this in a living organism, like a human, this may lead to extremely high levels of adverse effects and even death. So this, so far, has not turned out to be an effective strategy. And here's where our own scientists have added significantly to the research. Through the use of precursors, glutathione levels can be selectively modulated with really promising results. Thank you all for your attention, and thank you for inviting me to the call, not to mention the difficult questions.